Good morning, everyone. I'm excited to welcome you to today's presentation on comprehensive respiratory humidification and aerosol therapy. We'll be exploring key systems like heat and moisture exchangers, heated humidifiers, and bland aerosol delivery systems. Over the next few minutes, I'll give you an overview of how these technologies work and their roles in respiratory care. Let's get started. Let's take a closer look at comprehensive respiratory humidification and aerosol therapy, starting with the heat and moisture exchanger, or HME. An HME is a passive humidifier, and it's often called an artificial nose because it mimics the nose's natural function of humidifying inspired air. Its main job is to capture the heat and moisture that the patient exhales. Then, during the next breath, it returns up to 70% of that heat and humidity, helping to keep the airways moist and comfortable. Most HMEs are passive devices, meaning they work without any power source. However, there are also active HMEs that can provide additional humidity if needed. Now, some HMEs also include filtering capabilities. These are called HMEFs. While HMEs are primarily designed for heat and moisture exchange, certain models incorporate filtration to help remove particles from the inspired air, adding an extra layer of protection. Overall, HMEs are essential tools in respiratory care, helping to maintain airway moisture and sometimes filtering the air, which is crucial for patient comfort and safety during ventilation. Let's take a closer look at the different types of heat and moisture exchangers we use in respiratory therapy. First, we have pleated HMEFs, which feature pleated filter media. This design enhances both filtration and humidification, making them quite efficient for delivering warm, moist air to patients. Then, there are electrostatic HMEFs, which combine heat and moisture exchange with electrostatic filtration. This means they can effectively trap particles while maintaining good humidity levels. Moving on, hydrophobic condenser humidifiers use water-repellent materials to trap moisture, preventing water from passing through and ensuring dry, safe airflow. Lastly, we have hygroscopic condenser humidifiers, which rely on moisture-attracting materials to retain humidity. Each of these devices plays a vital role in maintaining proper airway humidity, and choosing the right one depends on the specific clinical situation. Understanding these differences helps us optimize patient care by ensuring effective humidification and filtration. Now, let's take a closer look at the key considerations for HME usage and design. An ideal HME should easily connect with standard breathing circuits, which helps ensure compatibility and ease of use. It also needs to have low compliance, meaning it shouldn't significantly distort the airflow or resistance, and it should add as little weight, dead space, and airflow resistance as possible to avoid interfering with the patient's breathing effort. When it comes to humidity, a crucial factor is providing at least 30 milligrams per liter of absolute humidity, ensuring the air the patient breathes is adequately humidified to prevent airway dryness. Additionally, according to ISO standards, the efficiency of an HME should be 70% or higher, which indicates its effectiveness in conserving and delivering humidity. It's also important to note that HMEs are generally intended for short-term use, typically 24 hours or less, since their humidity capacity can diminish over time. They are capable of producing between 70% and 90% of the body's natural humidity, helping keep the airway moist. Finally, we should be aware of the dead space added by the HME, which can range from about 5 milliliters up to 90 milliliters. This added dead space can impact ventilation, especially in smaller or more sensitive patients. So, these design considerations are essential to optimize both the device's performance and patient comfort. Now, let's talk about some precautions and limitations of using passive humidification devices like HME or heat and moisture exchangers. First, one of the main benefits we see with HMEs is their ability to reduce condensation in the breathing circuit. Compared to active humidification, this lower condensation risk actually helps decrease the chance of ventilator-associated pneumonia, or VAP, which is a serious concern in ventilated patients. However, it's important to remember that HMEs don't provide the full natural level of humidity, about 44 milligrams per liter, that our airways normally produce. Because of this, secretions can sometimes become thicker, which may lead to clogging the device, especially if humidity isn't adequate. Another key point is that resistance through the HME can increase over time. As water gets absorbed into the device, it causes more resistance, making it a bit harder for the patient to breathe comfortably after several hours of use. And finally, during medicated treatments, such as inhalation therapies, you need to remove the HME. Since these devices absorb medication and water, leaving them in place during treatments could interfere with medication delivery and affect their effectiveness. All these factors are important to consider when integrating HMEs into patient care, ensuring we balance their benefits with their limitations. Let's take a closer look at heated humidifiers, which are a key part of comprehensive respiratory humidification and aerosol therapy. Their main purpose is to improve water output by warming the gas that's delivered to patients. This warming helps prevent the drying of airway tissues and ensures the patient receives humidified air that's more comfortable and effective. Most heated humidifiers come with adjustable temperature controls, allowing us to set the ideal temperature according to the patient's needs. This flexibility is important because different patients or clinical situations may require different levels of humidification. The primary use case for these devices is with patients who have bypassed their upper airways, such as those on mechanical ventilation or those receiving ventilatory support. In these cases, the natural warming and humidification functions of the upper airway are bypassed, so we need to supplement that with devices like heated humidifiers. However, it's important to be aware of the risks involved. Heating inhaled gas carries potential dangers, such as airway burns, if the temperature isn't properly controlled. That's why the adjustable controls are so crucial. They help us maintain safe and effective humidification without risking patient safety. Overall, heated humidifiers are essential tools in ensuring patients receive appropriate humidification, especially in critical care settings, but they require careful management to maximize benefits and minimize risks. Now, let's take a closer look at some of the key components used in comprehensive respiratory humidification and aerosol therapy. First, we have the heated humidifier heating elements. These are crucial for maintaining the optimal temperature of the gases we deliver. One common type is the heated wire, which is integrated into the inspiratory limb of the ventilator circuit. This setup helps keep the gas warm as it travels to the patient, ensuring comfort and effective humidification. Next, there's the immersion-type heater, which is placed directly in the water reservoir. This method provides consistent heating by immersing a heating element directly in the water, ensuring the gas is properly humidified before reaching the patient. We also have the yoke collar element, positioned between the water reservoir and the gas outlet. Its role is to facilitate efficient heat transfer and prevent condensation from forming in unwanted areas. Then there's the wraparound type, which surrounds the humidifier chamber itself. This design promotes even heating around the chamber, reducing temperature gradients that could lead to inconsistent humidification. Lastly, at the base of the humidifier chamber, we find the hot plate element. This component provides direct heat from below, supporting uniform temperature distribution throughout the chamber. All these elements work together to ensure that the gases delivered are properly humidified and heated, which is vital for patient comfort and health during respiratory therapy. Now, let's talk about comprehensive respiratory humidification and aerosol therapy. One important aspect to keep in mind is that these systems typically require periodic refilling to ensure continuous operation. When refilling, it's necessary to momentarily interrupt the humidifier's function to add water, but we aim to minimize this downtime as much as possible. Moving on to the types of systems, manual systems use reservoirs and feed systems for heated humidifiers. These often incorporate float valves, also known as auto-feed valves, which automatically maintain water levels within the device. This setup helps ensure that humidification continues smoothly without frequent manual intervention. In contrast, automatic systems are designed to manage water levels and refilling processes more seamlessly. They are built to keep the system running efficiently without the need for constant manual adjustments, which can be especially beneficial in busy clinical settings. Overall, understanding these distinctions helps us choose the right system for our patients, ensuring effective humidification while reducing the workload and potential for interruptions. Today, I want to highlight the importance of comprehensive respiratory humidification and aerosol therapy. These are crucial components in maintaining patient comfort and respiratory health, especially for those on ventilators or receiving supplemental oxygen. One key point to remember is that these systems can evaporate more than 1 liter of water per day. That's a significant amount, and it underscores why proper humidification is essential. Without it, the airway can become dry and irritated, leading to complications. When performing humidification, always use sterile or distilled water. Tap water contains minerals and impurities that can cause infections or clog the equipment. Using sterile or distilled water ensures safety and effective therapy, minimizing risks to the patient. So, in the context of overall respiratory care, effective humidification not only improves comfort, but also helps maintain mucosal function and prevents thickened secretions. It's a vital part of supporting the patient's respiratory health throughout their treatment. Now, let's look at some key points about comprehensive respiratory humidification and aerosol therapy. First, setting the right humidification levels is crucial for patient comfort and airway protection. We need to ensure a minimum water vapor level of 30 mg per liter. This is essential because anything less than that can compromise airway function and discomfort for the patient. Moving on, the recommended temperature range for humidification at the circuit Y is between 34 and 41 degrees Celsius. Maintaining this temperature helps optimize humidity delivery without causing thermal injury or condensation issues. Finally, the optimal humidity level is actually achieved at around 37 degrees Celsius, with 100% relative humidity, which corresponds to about 44 mg per liter of absolute humidity. Achieving this balance ensures the patient's airways stay moist, which is vital for effective mucosal function and overall comfort. Connecting this to our overall theme, proper humidification not only improves patient outcomes, but also enhances the safety and effectiveness of respiratory therapy. Let's talk about some important aspects of comprehensive respiratory humidification and aerosol therapy, specifically focusing on problem solving and troubleshooting. One key issue we often encounter is condensation in the circuits. To minimize this, it's crucial to use water traps and heated circuits, which help control moisture levels. Additionally, positioning the circuits properly to drain condensate away from the patient's airway is essential for safety and comfort. Now, another significant concern is the risk of infection from bacterial colonization in condensate. When bacteria grow in the water that collects in the circuits, it can greatly increase the risk of respiratory infections in our patients. That's why maintaining proper circuit hygiene and drainage is vital. We also need to be aware of the aspiration risk. If condensate accumulates and a patient inadvertently aspirates it, this can lead to serious complications, including pneumonia or airway obstruction. Being vigilant about condensate management helps prevent this. Water waste and gas flow occlusion are other issues to consider. Excess condensation can waste water and block gas flow, which compromises the delivery of effective therapy. Ensuring circuits are properly maintained and drained helps prevent these problems. Finally, condensation in breathing circuits poses several risks, not only to patient safety, but also to the proper functioning of our equipment. By proactively managing condensation, we can improve therapy effectiveness and reduce potential hazards. Connecting all these points back to our overall goal, it's clear that careful troubleshooting and preventive measures in humidification systems are essential for safe, effective respiratory care. Let's talk about heated wire circuits and their role in comprehensive respiratory humidification and aerosol therapy. The main purpose of these circuits is to maintain the temperature of the gas throughout the ventilator circuit. By doing so, they help prevent condensation from forming inside the tubing, which can be problematic, and they also avoid temperature drops that could compromise patient comfort and safety. Now, to ensure these circuits function effectively, temperature sensors are strategically placed. One sensor measures the gas temperature right as it leaves the humidifier, giving us a clear idea of the humidity and warmth being delivered. Another sensor is positioned near the patient's airway, so we can verify that the gas reaching the patient remains at the optimal temperature and humidity levels. This setup is crucial because consistent temperature and humidity are vital for patient comfort, airway health, and effective therapy. And it ties into our overall focus on delivering precise, reliable respiratory care that keeps the patient's airway protected and well-humidifed throughout ventilation. Now, let's talk about comprehensive respiratory humidification and aerosol therapy. One key method here is bland aerosol therapy, which involves delivering tiny liquid particles suspended in gas. These particles are usually sterile water or saline solutions, and they can be hypotonic, isotonic, or hypertonic, depending on the patient's needs. This type of therapy is often combined with oxygen therapy to help keep the airways moist and support the mobilization of secretions. It's a non-medication approach that can be very effective in maintaining airway hydration and preventing drying out of the respiratory passages. When we introduce bland aerosol therapy, the main goal is to improve airway comfort and secretion clearance without the use of medications. It's particularly useful in situations where we want to support the patient's natural airway defenses and improve overall respiratory function. So, in summary, bland aerosol therapy is a versatile, non-pharmacological tool that plays a vital role in comprehensive respiratory care, especially when combined with oxygen support. It's all about ensuring the airways stay moist, clear, and functioning optimally. Now, let's look at comprehensive respiratory humidification and aerosol therapy. When it comes to aerosol generators, there are a couple of main types to be aware of. Large volume jet nebulizers are commonly used. They work by creating a high-velocity jet of air or oxygen to turn liquid medication into a fine mist. Ultrasonic nebulizers, on the other hand, use high-frequency vibrations to produce aerosol, and they tend to be quieter and more efficient. Moving on to delivery systems, we have direct airway appliances, which are designed to deliver medication directly into the patient's airway for targeted therapy. Additionally, there are enclosures that are specifically designed to optimize aerosol delivery while also enhancing patient comfort. These enclosures help contain the aerosol, making sure it reaches the patient effectively and safely. Finally, equipment for bland aerosol therapy refers to devices used to deliver humidification without medication, helping to maintain the moisture and temperature of inspired air. This is especially important in cases where we want to prevent airway dryness and promote comfort during respiratory therapy. All of these components work together to ensure that we provide effective, safe, and comfortable aerosol therapy tailored to each patient's needs. Let's take a closer look at comprehensive respiratory humidification and aerosol therapy. When it comes to large volume jet nebulizers, these devices are pneumatically powered and require a connection to a flow meter and a source of compressed gas. They are designed to deliver humidification effectively, and unheated nebulizers typically produce between 26 and 35 milligrams of water per liter. Now, the key point here is that while unheated nebulizers are useful, their output can be limited, which might affect the level of humidification delivered to the patient. This is where heated nebulizers come into play. By adding heat, these devices significantly increase their output, producing anywhere from 33 to 55 milligrams of water per liter. So, in summary, heated nebulizers enhance humidification by increasing water output, which can be crucial for patient comfort and mucosal clearance. This is an important part of aerosol therapy, especially in patients requiring higher levels of humidification to maintain airway moisture and improve therapy effectiveness. Let's walk through how a large volume jet nebulizer works step by step. First, High-velocity gas flow is essential. When gas passes rapidly through a small jet orifice, it creates a force that helps generate aerosols. This high-speed gas movement is the key to breaking up the fluid into tiny particles. Next, we have the fluid siphoning process. The jet's high velocity causes a low-pressure zone, which pulls fluid from the reservoir through a siphon tube. This is a clever way to continuously supply fluid for aerosolization without needing additional mechanisms. Then, the fluid is shattered into small liquid particles. These tiny particles are what we see as the aerosol. Smaller particles are especially important because they can reach deeper into the respiratory tract. Some of these particles exit through the outlet port, carried along by the gas stream, making inhalation effective. Finally, there's the air entrainment adjustment. A variable air entrainment port allows us to mix in additional air. This helps us control the overall flow rate and fine-tune the FiO2 levels, ensuring the patient receives the right concentration of oxygen. Overall, this mechanism is a smart combination of physics and engineering, designed to deliver medication efficiently while also providing oxygen support. It highlights how understanding fluid dynamics and precise control can improve respiratory therapies. Now, let's look at some of the airway appliances used for bland aerosol therapy. These devices are essential for effectively delivering humidified air or medication directly into the patient's airway. Common delivery appliances include aerosol masks, face tents, T-tubes, and tracheostomy masks. Each of these is designed to fit specific clinical needs and patient conditions. When it comes to tubing, all these appliances typically use large-bore tubing. This is important because it helps minimize flow resistance, making it easier for the patient to breathe and ensuring a steady delivery of the aerosol. Additionally, large-bore tubing helps prevent occlusion caused by condensate buildup, which can otherwise block the airflow and compromise therapy. The main purpose of these appliances is to ensure effective aerosol delivery, specifically tailored for bland aerosols, those that provide humidification without medication. They are primarily used in airway management situations and support respiratory therapy by maintaining airway moisture and comfort. In summary, these appliances and their tubing are vital tools in respiratory care, helping to optimize therapy outcomes and patient comfort during aerosol treatments. Let's take a closer look at ultrasonic nebulizers, or USNs, which are a key part of comprehensive respiratory humidification and aerosol therapy. These devices are electrically powered and use piezoelectric crystals to generate aerosols. The crystals convert radio waves into high-frequency mechanical vibrations, which then produce tiny aerosol particles that can be inhaled. One of the main applications of USNs is sputum induction, helping patients clear mucus effectively. An interesting feature is how we control the amount of aerosol output. By adjusting the signal amplitude, we can precisely manage the volume of aerosol being delivered. This mechanism allows for efficient and consistent aerosol production, making USNs a versatile tool in respiratory care. Overall, their ability to generate aerosols precisely and their specific applications, like sputum induction, highlight their importance in our respiratory therapy toolkit. Let's talk about comprehensive respiratory humidification and aerosol therapy, focusing on mist tents and hoods. These devices are specially designed to deliver bland aerosol therapy to infants and small children who simply can't tolerate masks. They provide a gentle, effective way to administer treatment without causing additional distress. Historically, mist tents and hoods have been used for over 40 years to treat conditions like croup. The cool aerosol they produce helps by promoting vasoconstriction, which reduces swelling and edema in the airway, ultimately decreasing airway obstruction. This long-standing use highlights their importance in pediatric respiratory care. However, we also need to be aware of potential risks. Enclosures like mist tents and hoods can cause heat retention and CO2 buildup, which might lead to complications if not properly managed. That's why careful monitoring is essential. We have to keep a close eye on the child's condition and the environment inside these enclosures to mitigate any risks associated with heat and CO2 accumulation. In summary, mist tents and hoods are valuable tools for delivering aerosol therapy to young patients, especially when masks aren't an option. But their use requires vigilance to ensure safety and effectiveness in treatment. Let's take a moment to discuss some of the problems associated with bland aerosol therapy. First, noise concerns can be quite significant, especially at high flow rates in pediatric patients. The noise can be distressing and may affect patient comfort and compliance. Next, bronchospasm is another issue to watch out for. Some patients might experience airway irritation, which can lead to spasms and further breathing difficulties. Overhydration is also a risk, particularly with the continuous use of heated jet nebulizers and ultrasonic nebulizers. It's important to monitor fluid levels carefully to prevent this complication. In addition, inadequate aerosol output can occur if the device isn't functioning properly. Regularly, checking the power supply and fluid levels helps ensure effective delivery of medication. Environmental exposure is another consideration, especially for immunosuppressed patients. We need to protect them and others from secondhand aerosol exposure to reduce the risk of infection transmission. Lastly, cross-contamination is a serious concern. Strict adherence to infection control practices is essential to prevent the spread of pathogens through aerosol therapy. All of these issues highlight the importance of careful monitoring and proper technique when using bland aerosol therapy to ensure patient safety and treatment effectiveness. Now, let's talk about bland aerosol therapy for sputum induction. The main goal here is to help mobilize pulmonary secretions so we can use them for diagnostic purposes. Essentially, we're trying to get a good sample from the lungs that accurately reflects what's happening inside without contamination from saliva. Having a high-quality sputum sample is absolutely critical for making the correct diagnosis. It allows us to identify infections like tuberculosis, pneumocystis pneumonia, or even lung cancer more reliably. A common method we use is the application of hypertonic saline aerosols, typically in concentrations ranging from 3% to 10%. This short-term treatment helps loosen and move those secretions, making it easier for the patient to cough up a sample. What makes this approach particularly valuable is that it's both cost-effective and safe. It provides a simple way to gather diagnostic information without resorting to more invasive or expensive procedures. Overall, this therapy fits into our broader goal of effective respiratory management, using accessible methods to ensure accurate diagnosis and better patient outcomes.